I would call upon Dr. Varun to talk about radiation hazards and safety measures in pain medicine practice.
Good afternoon, everyone. Thank you to the organizers for giving me this topic, because this topic is actually very important. And because of reading about this topic, I became more knowledgeable and will be very cautious in the OT now. And those who are listening, actually, this is one topic which might not make you a better pain physician, but at least you will live long. So that's really good for those who are listening. So I'll divide my talk into fundamentals of fluoroscopy, a little bit about the theory, and we'll jump on to practical tips, and then some future things that are coming up which can save us from radiation. So for pain physicians, the important thing is that all of the procedures are, most of the 99% of the procedures are percutaneous. So you need some imaging, right? Whether be it fluoroscopy or ultrasound or CT. So fluoroscopy is needed in many of the procedures, so you can't escape that. You will have radiation. And especially for the early carrier ones, like the people who are young, there's a learning curve. So what I used to do, I used to shoot again and again when I was learning. So more radiation, right? So we need to be really cautious. And it is said that in the early ages, there's radiation risks are more, and it goes down when you age. And the technical complexities of the procedure is increasing, so you need more fluoroscopy to do the procedures. So that's why sometimes you think that you were just standing beside the patient and you are taking all the radiation. You think like you are Superman or something. But no. Even Superman can have problems, troubles. So there was a survey which was done in which they saw that pain physicians know about the radiation safety or not. So the results were poor. So many of us don't know about that. So we need to know that, including me. First of all, C-arm. So C-arm has an X-ray tube, a little bit of theory, then we'll come to the practical tips. Those C-arm has an X-ray tube which has a source, so radiation comes to the patient and it penetrates, some attenuates, and then goes to the image intensifier where the image is generated and goes on to the display monitors to where we see that. So where is the radiation coming from? So radiation is coming from the primary X-ray beam, the scattered rays which goes away from the patient, and the leakage from the X-ray tube. The most important is the scattered rays, okay? So you can think of radiation like a football player, the American football rugby player. So radiation wants to go to the image intensifier or image detector. When there's a patient, there's thick tissue in between, it requires more of energy. So we need higher energy or more kV to go to the image detector, and we can increase the MA if we want to really reach, and the patient is really obese. So, but the minded that whenever you're doing things, radiation is increasing, radiation dose is increasing, right? So what are the effects that you can have because of radiation? So radiation can have a deterministic effects or stochastic effects. Those deterministic effects are like the threshold, there's a threshold dose for it. So it is usually 2 grays after which these skin or cataracts and hair loss infertility happens, which is, the good thing is it doesn't happen in OT. So we have really low, we have really radiation doses really low in our OTs. Stochastic effects are like which occur by chance. There's no threshold dose, even a tiny amount of radiation can cause it, like cancer and all. So you can compare it with drinking and gambling, okay? So what happens in deterministic effects, like you consume a threshold dose of alcohol to get drunk, right? So same with the radiation. And then more you drink, the more drunk you get, right? Some of the effects are reversible, some of them are not. So you have to be really cautious about the dose. While stochastic effects are more like gambling. Even if you play once, you can be a winner. Winner here is getting cancer, okay? So if you play more, then you can increase your chances of winning or getting cancer. So yeah, be really cautious about that. And it was a study in which they saw that caudal epidurals and the cervical internal laminar. So caudal epidurals have a higher radiation dose. So be cautious in doing caudal epidurals, while the lowest dose was for cervical internal laminars. Radiation dose is usually in units of sieverts. There's an equivalent dose which is for an organ or a tissue, and the effective dose is a summation of the equivalent dose coming to the whole body exposure, right? So let me ask you, do we know what is our dosimeter reading? So let me ask, first of all, do we love our life? Yes. Do we love our family? Yes. Then do we know our dosimeter dose? No. So, huh? Oh, then you love yourself and your family and you want to live long, huh? So we should know that there are two dosimeters that we need, right? One inside the apron and one at the collar outside it, right? To see the effects on the eye and the skin, the outside one and the inner one. So, and there is a ring badge also. There's a ring badge in which you can see what is the dose at the hand, okay? So how much radiation is fine? So if you don't want to get stochastic effects like cancer and all, even you have to leave your practice. But this is the one which was given by ICRP, that 100 millisievert over 5 years is the one, and or 50 millisievert over 1 year, in any 1 year. If we want to decrease it, we need to follow the ALARA principles, which is the as low as reasonably achievable. So we'll come to the practical tips now, which are very important if you want to decrease your radiation dose. So minimize your beam on time, use it when it is actually necessary, when your vision is on the monitor and you want to see something, right? Don't take it otherwise. Be in a low scatter area, be away, stand back from the radiation. Don't think that I will just do the procedure fast, I'll be staying there close to the patient doing fast. No. Stay away. Just take a radiation only when you are away from the patient. Because the inverse square law, more farther you are, the better it is. And X-ray source has to be below, not above, because the scatter radiation is coming all over in the room if it is above, while if it's down, it's more on the floor. Minimize air gap, so you want to minimize the, do we have? Okay, so minimize the air gap here. So you want the image intensifier to be close to the patient, right? So that scatter is less, and also the image quality would be better, right? Use collimation. We have collimation in our machine, so we need to use that to restrict our beam. And we can use a laser beam also, right, for accurate positioning of the fluoroscope. You don't need to take unnecessary exposures, right? So there's two types of magnification that is in the machine. One is the electronic magnification, which you can do while taking the picture, and then there is a digital zoom, which you can do after the image you have taken, which is post-processing. So electronic magnification is a no-no if you want to decrease the dose. If you can do it after you have taken the picture and you can zoom it. Cine mode, there are higher chances, higher radiation dose, so use fluoro more. If it is absolutely necessary, like you want to see the vascular spread and all, then you need to do a cine one. And these are the angulations which you need to be aware of. So here you can see that this is the cranial tilt. So X-ray source is closer to you. So, and also in the contralateral oblique, the X-ray source would be closer to you, so be a little far away. And when you're taking lateral pictures, see to it that image, so this is a wrong thing, right? So the X-ray tube is here, if you're standing here, you're standing close to the X-ray source. You want to stay towards the image intensifier rather than the X-ray source. Okay, use filters more. Use pulse mode, because in the naked eye you can see it as a continuous at 15 frames per second, so we can use pulse mode. Last image hold is there, in which you can hold the image and then you can collimate, filter, you can do things with that rather than taking picture again and again. Use lower contrast or higher KV. It said that this compromises tissue differentiation, but in a study they saw that even at 80 or 90 there was not much difference, so you can use a higher contrast and decrease the radiation dose. Shielding is very important. Everybody knows about that shielding part. We'll be coming to lead aprons and all. So architectural shielding, walls of the room have to be 1 mm to 3.5 mm for the lead. And the equipments, there are multiple equipments that if you don't have, get it. These are really useful. The table suspended and mounted drapes, these are really useful. And this is also available. These are the drapes which are there. The only thing is that the area which you want to see, you need not put the drape here, and otherwise you can keep it on the patient, and the radiation can decrease a lot. Personal protective devices, which are aprons, thyroid shields, glasses, and gloves. We'll talk about each of them. The aprons are of two types, one piece and two piece waist skirt. One piece, you have seen that they are open on the back. So better is to have a two piece one, the skirt one, which covers the back also. And you need a 0.5 mm lead in that. which can decrease it. You can see, sometimes they are damaged, right? They're damaged. You can see that visually also, and you can see it fluoroscopically also. You can put it on the X-ray, and you can see whether they are fine or not. But if you ask me which is the best lead apron, whichever fits you well, because otherwise you will have back problems and all. So better get a one which is comfortable for you. Can come from here, and also it can come from actually below, right? It can come from below if you're not if you're seeing like this and the radiation is coming from below, it can actually enter from below also. So that is why I would say that lead cap, you don't need to have that, because if the radiation is coming and there's a gap in here, the radiation can get trapped in between, so you will be having more radiation in your head. So this is actually not needed. Hand protection, so there are gloves that come, radiation protective gloves. Better avoid putting your hand when you're taking the radiation. That is the best thing to do. I would say again that lead gloves not needed, because if you're putting your hands in that with the gloves, what is happening? Your hands are saved, but more of scatter radiation to you, so no need. What about this lotion? Lotion is there which can protect, but there are chances of infection. So this is by FDA, so no need to use that also. So what about the future? Where are we heading now? So this is the area. This is the age of AI and AR, VR, and all robotics and all. So I think that will save us from radiation, because you really not because if the robots come, then we don't need to have actually be present in the OT. We can do it remotely also. While this AR and AI guidance can decrease the radiation dose, because they guide you, they give you a trajectory. The needle trajectory is being given. So they have used this is from one of the study in which they use it for transpedicular vertebroplasty. So, and also there is a study in which they have used for needle guidance. So this is the area in which the research is going on, and they are coming up with more and more AI protocols. There is one robot I could find in which has been used for one of the pain intervention, which is vertebroplasty, and also for minimally invasive transpedicular screw fixation. So this major X robot has been used. While there are multiple robots that spine surgeons use, there are multiple robots, probably 6, 7 are there, which are used for spine surgery. But this one has been used for vertebroplasty and transpedicular MISS. So just finishing in before time rather. So the take-home message is know your radiation dose. If you love your life, if you love your family, and if you want to live long, then you need to know your radiation dose. And we feel that more busy we are very happy that we are earning more, but you are also taking more of radiation. So, so you need to be aware of that. Thank you.